Good afternoon, everyone. Thank you for joining our webinar today. My name is Anna Brinkman, and I'm a Market Development Manager here at Coloplast. Coloplast is a company that develops products and services that make life easier for people with intimate healthcare conditions, including but not limited to incontinence. Today's webinar is called Relief from Leaks is Possible, Understanding Stress Urinary Incontinence and Treatment Options. And we are thrilled to have Dr. Briana Walton joining us today as our presenter. Dr. Briana Walton is a double board-certified urogynecologist who has specialized in female medicine and pelvic reconstructive surgery for over 20 years and is the director for the Center of Feminine Wellness and Surgery in White Plains, Maryland. We're so fortunate to have her here with us today, speaking about this important topic. In addition to Dr. Walton, later in the call, we are fortunate to have Sarah Schuchart joining us. She is a senior principal engineer at Coloplast and a holder of over 50 patents. She has done extensive research and work on women's health products, and we're excited to have her join us as well. At this time, I'd like to invite Dr. Walton to join me as she walks through today's agenda. Hi, Dr. Walton. Thanks for joining us.
Hey, Anna. How are you today?
I'm wonderful. Thank you.
So I am really, really excited about talking about urinary incontinence. So let's first start with some just level setting. Incontinence is an issue when it's an issue for you. It is the involuntary loss of urine from the body. Now, if you put bowel incontinence in front, it'll be bowel incontinence. So that is pretty straightforward. But the interesting parts about it is that it can have multiple sort of flavors, and it can be particularly bothersome or not bothersome at all. So you can have small amounts of leakage or just a little bit of a dribble. Or you could have total loss of control. It could be triggered with physical activities or triggered by just standing in a line at the grocery store. So incontinence, like I said, it can present in multiple ways. So my goal or what I would consider successful for our time together today is just to say, number one, I want to educate you about urinary incontinence. And then I hope to activate you that if you're not here for yourself, that you're hopefully an ambassador for someone else in your life who's really important. Maybe you're here for your mother, your sister. It doesn't matter. Help each other. That's what we do as women. And then finally, just to alleviate some of these things. There are a lot of things that we don't have control over. There are a lot of problems that we cannot solve. But this is not one of them. Now, one of the statistics that you may have seen in that video showing was that there are about 78 million women in the United States out of 168 million. So that's about 40%, 46% of people have leakage. That's a lot. Most of those patients, or a large number of them, have stress incontinence, which is what we're going to focus on today. Now, even though only about 45% of women over the age of 30 will have stress incontinence, that means about 50% or more potentially could have stress incontinence. So it's not something that's just, sort of an older woman's disease, and it's not a normal part of aging. From a physiologic standpoint, we understand that there are some changes, and we're going to delve into this a little further when we go to our anatomy lesson, which I will not quiz you on, I promise. But most women in the United States and abroad wait a long time before they finally say, I don't want to deal with this anymore. I think as I've gotten older, there are probably three things that really stress me out, right? Like if it bothers my head, if it bothers my heart, or if it bothers my pocketbook. And so from a mental health standpoint, incontinence can bother you. I mean, if you are anxious because you're afraid that you might leak on yourself when you go to church, or if you're a little more depressed because you can't participate in jumping on the trampoline with your children or grandchildren, even though your body says you can do it, your bladder says no, that causes stress. From a heart standpoint, most of us are trying to be more healthy. We're trying to exercise. We're trying to do things that will sustain our bodies. But if you are leaking during physical activity, there is a disincentive. Sometimes there are issues related to actually physical problems like skin ulcers or infections. Now, this isn't very severe cases, but when you are wearing pads all the time and you can't afford to change them as frequently as you would like, this becomes more common. And then finally, your pocketbook. Now, this number, $1,400 a year, may not seem like a lot to many, but it is. If you think about how much we spend on medications or our deductibles, and when you have to compete with saying either I'm going to pay for pads or I'm going to pay for dry cleaning or diapers instead of paying for my medications or other things or other activities, I think that number becomes much more important. So as you can see, the take-home message that it does affect us, it stresses us out. Let's talk a little more, though, about anatomy. Now, we've got a slide here that basically shows the entire urinary system, which it consists of the kidneys, and those little tubes that are shooting out from it are the ureters, and they deliver urine to the bladder. Now, that bladder is able to sustain a small capacity, right? It can be fairly empty, 50 cc's in it, but it can actually hold about a half liter or more. And that's a lot. And we want to thank the sphincter muscle for it being able to do it. So let's walk through sort of the physiology of this. So your bladder gets filled up with urine through the kidneys, delivered in by the ureters. And that muscle contracts. So there is this sort of trade-off between the bladder and the sphincter. When one is tight, the other is loose. Once the bladder fills up to its capacity, we said about a half a liter, right? That bladder sends a signal to your brain. Hey, am I in a socially acceptable place to go to the restroom? And if that's the case, the bladder will contract and the sphincter relaxes. That cycle continues to repeat itself over and over again, usually about 8 times or less per day and less than 2 times per evening. Now, as I mentioned, there are a lot of different types of incontinence. So there's stress incontinence, which is related to physical activity, whether you're lifting, you're running, you're sneezing, or you're laughing. I think the other type of incontinence tends to be a little more, it's fun. Frequency, urgency at nighttime urination, which is better known as overactive bladder. And for those of you who are extremely gifted, you have both. But the issue is that these problems can be solved. And so I want to focus a little more on what we are going to do to take back your normal, because you do not have to live like this. A little more education. Again, that normal bladder function is meant to sit quietly, peacefully, while the urethra is closed and the sphincter muscle contracts. In the case of overactive bladder, the bladder muscle or detrusor sends a signal to the brain that I'm full, when in fact it is not, and you end up going to the bathroom too often or urgently. I can't hold it. Get out of my way. And this is sometimes triggered by hearing running water, or as soon as you're driving around the block 5 times, as soon as you put that key in the door, though, you're in trouble, or even seeing the toilet. So we call that terminal leakage. The final, and what we're going to talk about and spend most of our time, is stress incontinence today, which is a relaxation of the sphincter muscle. So any pressure in the abdomen, whether you're coughing chronically or you're bending over or you're picking up your grandchild, that sphincter sometimes is not quite strong enough, or the support underneath it is not good enough to hold the urine inside of the bladder until the socially acceptable time. The gifted bladder has a combination of both stress incontinence and overactivity. And so for those issues, they are treated very differently. And we're going to take a little time to talk about each one. Okay, before I jump into the treatment, let's spend a little time. There are items in your life that are modifiable, and there are some issues in life that are not modifiable. Who you are, who you were born to. whether you had a 10-pound child and how it was delivered, and if it was assisted out through it with a vacuum. If you have a family history, your mother has this problem or she has prolapse, or you had to have some sort of surgery. Those are factors that we do not really have a lot of control over that can influence the occurrence of stress incontinence. But what we can have control over are some of the symptoms of menopause and our lifestyle. So if we watch how much caffeine we take in, and we control our body weight, as everybody says, and we are not a smoker, that can really help to diminish some of the occurrences of stress incontinence. I think once you are, do I have stress? Is that me? What is it exactly? Your next question should be, who can help me with this? And there are many physicians who are familiar with this, but you want to find the right person because you want to hear about what your options are. And options really vary based on whether or not you want to just sort of continue with behavioral modifications like lifestyle, stop smoking, using pads, or even get help with a physical therapist. That's a really great option when there's no damage to those pelvic floor muscles. But some of us are just not really willing to commit to ongoing maintenance. We want to have something, we want to be treated, and we want to forget about it. No one wants to continue to think about their urinary leakage. So when you do see that provider, there's going to be a lot of questions that are asked that you're going to say, why are you asking me this? Because everything is interrelated. So if you're somebody who hurt your back years ago, that could have an impact on urinary leakage. If you had major surgery to your abdomen or even back surgery, that can affect it. And it's really important when we're doing our physical exam to sort of match what we're hearing in terms of your complaints to what we see on that exam. That exam is very thorough. It allows us to get some idea about the support of the pelvis and whether any changes that are related to menopause. Sometimes your provider will ask you to do a diary because they really want to understand what is the volume and what is the pattern of your urinary leakage, as well as how many times you go to the restroom. In the office, we will often ask on that very first visit for you to cough or bear down as hard as you can so that we can see if there's actual leakage with a modestly full bladder. And some women actually have leakage associated with a urinary tract infection, so we check for that. In circumstances where we can't necessarily document what is happening, we will say sometimes, go home with this dye. It's like an azo pill, or even take a vitamin B12 or vitamin B so that you can dye your urine. So when you cough, you can look and see, is there a stain there? Now we have more sophisticated testing such as urodynamics, which I would refer to almost like an EKG for the bladder. You're getting an idea if the bladder function is normal. Is it big? Is it small? Is it stable? Is it not? Does it leak? When does it leak? All those questions we want to know answers to help direct us in a better path. If you've been a smoker or there's blood in your urine, your provider will sometimes ask that we look inside your bladder with a cystoscope. And then it's also important to understand whether or not you're emptying your bladder normally. So a post-void residual is a way to measure, either with a sonogram or with a catheter, to say how much is actually there. I mentioned before, you want to land in the right place when it comes to urinary incontinence because you want to have options. And I think this is really beneficial because there are across the United States a number of providers who can be very helpful for finding solutions for this issue. So whether you are go to your gynecologist, which most of you have had regular pap smears or in your routine screening, they're a very good way, and some actually will provide care for you. The more common providers tend to be urogynecologists like myself and urologists. Both of these are very specialized, whereas a urogynecologist tends to focus on women's health and the reproductive tract as well as the urinary tract, urologists can focus on both. Okay, let's jump into a little bit of treatment options. And I'm going to start off with talking a little more about our fun, right? Frequency, urgency, and nighttime urination associated with overactive bladder. I mentioned earlier, this does not tend to be a surgical issue. We usually say, well, let's focus on your lifestyle. Watch how much caffeine you're putting in your, and quite frankly, many women are trying to lose weight and they're using sugar alternatives, and that can be a significant bladder irritant and result in people having urinary leakage and or frequency. So look at that, adjust it. I'm not saying stop it. I'm just saying look at it for yourself. There are certain medications that we can use to help calm down the bladder. And then if you are not necessarily responding to, or you have decided, I really don't want to have to take a pill. I already take 5 different pills every day. There are injectables, and there are ways that we can actually control some of the stimuli peripherally to the bladder by basically doing acupuncture in the office. There are newer techniques that have come out in the last decade or so, or even a little bit longer than that, that really try to take advantage of our understanding of the nerves. And so there are implantable, what we would call pacemakers for the bladder, that either go in through the vagina, through the back, and there will be some newer techniques where we're putting it more towards the leg. So stay tuned. You'll hear more about that from Coloplast later down the line. There are also non-surgical treatments for stress incontinence. Again, having a healthy body weight and staying in shape, keeping the core, that floor, and that back door all together so that you are strong in this area can be very helpful. And that can happen either on your own or with the help of a physical therapist. Sometimes we just need to retrain the bladder because we get into these habits where we've overextended our time. Many of us walk around with our bladders overfilled, and that's part of the reason that we have some leakage issues. But today, I'd like to focus primarily on ways to alleviate this issue fairly quickly, as well as more permanently. So there are 2 basic concepts when it comes to surgical treatments for stress incontinence. The first is to inject that urethra near the sphincter. I wish I was playing bingo with you guys. These words are coming up and you would pass your educational test. But essentially, this bulking agent is used very much like you were bulking your lips or putting filler into the face to help that sphincter function better. So it essentially closes the area where it was weak so that it's much less likely that urine would come out. Now, depending on the type of bulking agent, you might have to have this repeated several times. And they don't necessarily last for years and years and years, depending on what type. On the other hand, we have been fortunate enough, and I have mentioned on my own that I have been a beautiful recipient of a sling as well, that we have these smart pieces of material, a piece of mesh, that is placed in a location that acts more like a hammock to support the urethra. And it really mimics our normal support structures. And in that, so when we cough, when we laugh, when we sleep, it a little increase in pressure so that it prevents leakage, but it's not so obstructive that it doesn't allow urine to pass. So let's take some time to talk a little bit about sling surgery. One of the reasons why a lot of women decide, I think I'm going to go with the sling over a bulking is, one, it's a fairly quick procedure and it's outpatient. But I think the 2 things that I hear is that the recovery time is relatively short. It doesn't have a significant impact on your lifestyle. You can return to a lot of your activities fairly quickly. And we have a lot of data. slings have been around for a very long time. I started my training in 1999 when slings first hit the United States, and it has been the gold standard for our practice for years. In fact, part of the reason I'm here today is because I want to have this option available for my patients. If I cannot really help women with this type of procedure, and I think most of my colleagues would agree, then we're going to go back to the old age when either you still leak or you don't pee enough with the surgical procedure. And this is endorsed by our society, the American Urogyne Society, as well as SUFU. So it is a procedure that has been vetted, it's been studied, and there are several different varieties. Now, depending on your provider, they may say, well, I think you would be better served with a traditional first generation retropubic sling. Now that in that very first picture, we're going to point out some anatomy. That sling is sitting as a U up underneath the urethra, U under the urethra, and it passes in front of the bladder. Now, one of the concerns is that it comes close to the bladder, and so some have migrated and choose the second generation option, which is more in the shape of kind of like a V. And that V also supports the urethra like a hammock, but it passes through. There's one entry point and two exit points, like the first generation. And it allows us to adjust the tightness of the sling under the urethra. We're going to spend time talking about a single incision sling. So several differences. It doesn't get too close to the bladder. It does pass under the urethra and out into that little space that you're seeing. The O is obturator, where the circle is, but it doesn't penetrate through the thigh. So it's only one single incision. And many of my colleagues who have done first generation and second generation, one of the reasons they have switched to using this single incision sling is primarily because of what patients have come back and told them. I'm going to jump to the next slide because I would love for Anna to bring on one of our colleagues who works for Coloplast, and not just because she works for Coloplast, but I think it's really important for you as women to know that this company was started by a woman. This company supports the growth of their product line based on engineers like this young lady we're going to introduce. Sarah and Anna.
Yeah. Thank you, Sarah, for joining.
Hi. Thank you.
I guess starting with,
so Sarah, tell us a little bit about who you are and what you do for Coloplast, because you use big words that I don't always understand, and so I have to go look them up when you're not.
Sure. Yeah, my name's Sarah Schuchart, and I started at Coloplast / Mentor in 2006, actually. Wow. So I've been around a long time, and my degree is actually mechanical engineering. So I've been doing women's health pretty much ever since. So
that's beautiful. And so you have been involved in actually designing this smart piece of plastic, so to speak.
I have. We started actually designing Altis probably 16 years ago, and spent maybe around 4 years developing and testing it prior to getting FDA approval on it.
So, I know a lot of women are concerned about some of the things that they've heard, but I think it's really important for us to reiterate that this has been around a really long time. And this particular sling has been studied again and again and again and again, and continues to perform in a way that is very predictable. And that has to do with the design of it. And so do you mind just kind of giving the highlights of that piece of material shown on the right side?
I think our probably the most special or interesting part of this device is the mesh itself. I have one in my hands here, And you can see it's really thin, it's really soft, super flexible. It's also one of the things that's very unique to our mesh itself is that it's knit to width. So along the edges here, there's no sharp edges. It's all one single piece of fiber. So there's nothing sticking out that you can feel through the skin. And then the other really special thing about the mesh is that we designed it intentionally to mimic those supports under the urethra that have been weakened or broken.
I think that's really important because one of the things from a biological standpoint is that we don't want to replace something that's broken with something that doesn't match your body. And so this really allows you to sort of mimic normal pelvic structure.
Exactly.
And, you know, one of the other concepts about slings that women get concerned about, we're going to talk a little more about, is just being able to feel it and see it. So you mentioned how thin it was, so that the woman herself or her partner can't feel it.
Exactly.
So, you know, when we're doing these procedures, ladies, that 7.5 centimeter or a little bit more piece of material is fixed to anchors. And that's really important because those anchors get fixed in some firm tissue. We call it a membrane that covers that big O next to the bladder. You can kind of see it on that middle portion of the side. Now, the anchors kind of act like almost drywall anchors that you can push them in smoothly, but they don't come out with any kind of force. One of the anchors is fixed. The second anchor is actually adjustable. So that makes the sling a lot more what I would consider customizable. So it's not one sling fits all or one size fits all. So that allows us to very minor or minute adjustments in the operating room that are special for you as the patient, and not just kind of put it in a space and hope that it's going to be right. Any other comments about this, Sarah?
I always tell everyone if I ever had to get a sling, this will be the sling I get.
All right. Thank you for joining us. And thank you for all the work that you do for this company and for women across the world.
You're welcome.
All right. So elephant in the room, right? Like, what are we worried about when we put these slings in? And any kind of surgery is at risk, right? Whether you have your eyes, you get cataract surgery, or you have your hips or your knees, or you have to have, cosmetic surgery. There are risks associated with this. So our general risk or concern is how close are we traveling to the organs, the bladder, the bowel, or blood vessel. And you saw in the images that we try to avoid some of the larger areas, but it's a low risk of bleeding and a low risk of injury to blood vessels. And the space and the design of the delivery device, or the needle, is really special because it doesn't allow us to travel too far and get into spaces and places that we don't want to. Another concern is, what about infection? Well, there are steps that we take before the surgery, during the surgery, and after the surgery. So to get an infection of the sling is relatively low, and I'm talking about less than 1%. It's more common for us to see sometimes with just instrumentation, looking in and with our camera during the procedure to get a urinary tract infection. And as long as that pattern isn't repetitive, we're not really worried about it in the immediate 30 days after surgery. Urinary problems such as not being able to empty, as well as urgency, can occur, but it's a relatively low number of women. And that usually has to do with our adjustment, as well as, concomitant problems with the mixed incontinence, or that double gifted bladder. Very uncommonly, you will have issues related to anesthesia, and that's related to our screening and your overall health. What I like about being able to do these slings is that you can do it with very light anesthesia. You can do it with a spinal even. And depending on what site, whether you're at a surgery center or a hospital, really is fairly quick, and you will be discharged from the hospital usually the same day. Mesh complications are what we have heard about for the last, since 2008, and really the FDA has been our kind of guiding force to say, listen, make sure you tell your patients that mesh is a foreign body and that that body can be associated with pain. It can cause infections or pain even with intercourse. And it's no different than any implant placed in the United States. Like I said, for hips and knees, all implants are associated with some degree of risk. We also talked a little bit about injuring the organs. And so we look inside of the bladder with our camera during the procedure just to make sure that we've done the procedure safely before we send you home. So the day of surgery, and again, depending on where you have that procedure done, you could either go home the same day, or if you're having other procedures at the same time, you might be the next day. But the sling itself usually takes us less than 30 minutes. And the type of anesthesia we talked about. The key for us before you go home, we want to make sure your pain is under control. You know, it doesn't have to be zero pain, but we like it like less than a 3. And we want you to be able to empty your bladder on your own. If you have problems, we will sometimes send you home with a temporary catheter. And most of our patients who go home with a catheter, that you only need it for a day or 2, depending on what day of the week we did the procedure. I think I see a question about how much time do you have to take off for a sling? That's a really good question. Most people who perform these procedures will counsel their patients about more precautions, okay? So it depends on what kind of work you're going to return to. If you work for UPS and you're going to be lifting and bending and, you know, carrying heavy items, we're going to say take off more time. If you sit behind a desk or you work from home, you don't really have to take off any time. You could have a procedure on a Thursday and be back at work on Monday. I think it really is an individual conversation with you and your provider to really assess your risk for slight adjustment of the sling or putting too much tension on it. I think the key is making sure before you go back to work that you are emptying your bladder appropriately and that you really don't need a catheter. You may have seen before we started, there was a video where we interviewed 2 of actually my patients who had a sling. And I think that video really, for me, it becomes very emotional when I talk about it because it's a mother and a daughter. And how many of us say, you know, I look like my mom, I smile like my mom. Why do you want to leak like your mama? You know, I think in this video really highlights that, you know, there are things that we share in common with our families. And that, you know, sometimes one of us needs to be the brave one to go first and say, I need some treatment. I need something to help me. In general, with this procedure, we've got such significant success rates with our data that most of our patients will say, hey, this is so much better than where I was, about 93% almost. And about 90% will say, I'm really quite satisfied with the results of my sling. And quite frankly, you know, the data is important, but when you listen to the words of another woman, and that's why these forums are really important. Me as a provider, I think, gives you clinical insight to why you might be a candidate and why you might, my job is, as I said, educate you and hopefully activate you so that you decide to do something so that you can alleviate some of these issues. But sometimes you just need confirmation. You need to hear it from somebody else who had the same procedure. And on the website, you're going to see other women tell their stories to say how they got their life back, how this procedure changed them. And I quite honestly, sometimes I get a little emotional when patients come back to me and they tell me how something so small made such a big difference in their overall head health, heart health, and even their financial health. I think another question that comes up for us is, can this get paid for? I mean, this is like an elective issue, right? Yeah, it's elective, but it's not cosmetic. So most insurance plans, including Medicare, will cover these procedures, and you will have an opportunity, if need to consult so that we can find out, hey, are you going to get covered? I think that the challenge is where you have that procedure done, whether it's a surgery center or a hospital. And so those are key questions that you're going to want to ask the provider. Where do you do your surgery? And is it different depending on, is my cost, is your out-of-pocket deductible going to be different depending on that site of surgery? So, we're getting closer to the end here, and I want you to, if you haven't already, jump onto this site, femalepelvicsolutions.com, because I think you'll find a lot of helpful information for yourself and for other women in your lives, and to be able to connect with the right provider to help you understand and make good decisions for you. You have, unfortunately, limited control about certain things that happen in this world. We have limited control about, aspects of our life, but this you got control over. You can take back this part of normal. You can get back to who you used to be. And so I hope that this has been really helpful for you and that you can actually activate and alleviate some of the symptoms associated with stress incontinence.
Dr. Walton, we are so appreciative that you took the time to present on this important topic. Thank you also to Sarah for joining as well to give us a little more information about how Altis was developed. And if you do have any further questions, I encourage you to check out femalepelvicsolutions.com. Lots of great information there on Altis. We'll eventually be putting this recording up there as well, so you can watch again. But also a great place to look for our physician finder if you want to find a specialist like Dr. Walton near you. So thank you again for joining, and have a wonderful rest of your afternoon. Thanks again, Dr. Walton.
Thank you. And thanks, everyone.